Hi, everyone. We are going to go ahead and start the Scope at Launch, a special edition of the Scope podcast. My name is Paige Heitman, and I'm going to be your host for today's webinar. We're going to touch on a couple of housekeeping items before we get started. First, the Zoom session will be recorded. We'd love to know who everyone is, so please ensure that your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating this session with my Phelps Health marketing colleague, Hillary McCash, so one of us will be sure to help you if you need it. Also, we would love to see everyone's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, please go ahead and turn on your video. You'll note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box and we'll try to get it answered. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just to one person. We'd encourage you to send your comments and questions to the whole group, but do whatever you feel most comfortable with. If you feel more comfortable sending a private question or comment, that is totally okay. We also want to encourage everybody to use the reactions that Zoom offers during this discussion today. You can use a hand clap, a thumbs up, thumbs down, etc., to let us know if you like, love, agree, or disagree with whatever we're discussing. Reactions can be found in two places, one either on the top or the bottom of your screen, and one that you'll see whenever you display the participant list. We will be conducting a few polls throughout this Zoom meeting, so you'll get a chance to interact then if you choose, and of course, don't forget the chat feature. Some of you might be using a mobile device while others of you are using a laptop or a computer. If you find that your features aren't working the same way, we just ask that you participate with us in a way that you can, however that is. If you find that you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist. So today I'm super excited. Our guest is Cindy Butler, who is the Administrative Director of Patient Care Services at Phelps Health. Welcome to our show today, Cindy.
Thank you so much. I'm happy to be here.
Yeah, I'm super excited to kind of dive in and talk about this topic. But before we get started, I actually want to kick us off with a polling question. So let me populate that really quick. And again, this is completely anonymous. The question is, are you a registered donor? And it's just real simple, yes or no. Give everybody about 10 more seconds to answer that. Couple more seconds. And we're going to go ahead and end the polling, share those results. So it looks like about 70% of people are registered organ donors. And then we have a handful of people that maybe are not organ donors. Maybe they're considering being an organ donor, which is perfect because that's what we're going to be talking about today. So to dive in with question one, Cindy, what is Code Hero and how does it relate to organ donation?
Well, Code Hero is actually a program that was implemented here at Phelps Health as a way to honor the donor and their loved ones. This is specific to the organ donor. It provides an overhead page here at Phelps Health, which alerts staff that we have a life-saving organ donor here on the campus. And it gives us a time frame of when that transplant team would be here and would be leaving the facility with the patient. We actually line the halls in a moment of silence, and the crew from the EMS system that transports the patient to the St. Louis area actually brings the patient and their loved ones through that hall of honor. So it gives us an opportunity to sit silently, but yet provide that emotional support of just presence during the exit of that patient as they leave the facility to be transported to St. Louis. It's just it's an awesome thing. I mean, it's an amazing event that there's so much energy in the hallway and so much emotion that it's an incredible encounter for those of you that haven't had a chance to participate. We welcome anybody here on campus or even in the system to come over anytime that's an alert overhead and participate. The halls have been lined the last couple times, so it's really an honor to be part of that.
So Cindy, kind of to capitalize on what you just talked about, how did Code Hero begin? How long has Phelps Health been doing that?
Oh, that's a tough one for me. I think this is our third year that we've been doing it here, but it's actually become like a standard across the nation. We call it Code Hero here because we have all types of codes that we call overhead. You have the code blue, We have, the medical assist. We just have so many things that we train our staff to understand and acknowledge in an overhead fashion. And it just made sense to come up with something, and the hero side of it just matched. So Code Hero might be specific to Phelps Health in the way that we call it, but it's not specific to those in healthcare. Well, I shouldn't say not specific. It's become more of a standard in healthcare across the or across the nation in general, as just a way to honor those that are organ donors.
Great. So moving along to question 3, why is organ and tissue donation so important?
That is another hot topic. I think there are many reasons that organ donation and tissue donation is so important. I think that we start with just the fact that the act of one organ donor can enhance or save the lives of 8 individuals and provide tissue, which would enhance up to 50 other lives. So the impact of one donation on a community could affect 58 people or more. So just to think that it's not just a 1-for-1 ratio, it's 1 for many, and it's just huge. Approximately 20 individuals die daily waiting for a donation to receive a transplant, and that's big. I mean, 20 individuals every day. And I think the most surprising statistic for me was that every 10 minutes in this nation, a new person is added to a transplant list. So if you think, that every 10 minutes somebody else needs a donation, in a transplant fashion, whether it's tissue or organ, that's huge when you think about how big the United States is and how much that covers and how many people that must mean nationwide. The statistics for here in Missouri are that 1,326 of our Missourians are waiting for a transplant. So that's another fairly big number. It actually stays around that 12 to 1,400 mark consistently. So there's definitely still room for individuals that are on the fence or that haven't made that decision to make certainly an impact upon their death for someone else, because that number seems to stay pretty steady for us.
Yeah, that's a pretty big number. A question that I thought of while you were talking about this is, how does somebody get on a transplant list if they need a donation? What would be reasons that maybe they would need a donation?
There's a multitude of them. I mean, I personally know of someone that just recently had a liver disease and ultimately needed a transplant in order to save her life. There are people that are born with different diseases like cystic fibrosis and sometimes need lung. There are just varying degrees of reason for it. As far as organ donation, now tissue donation, that could be a multitude of things. I mean, if you think about how many people have cornea implants, or eyesight issues, that's considered a tissue. So those are donations that happen almost probably weekly at many facilities. Sometimes probably daily, there's a transplant of some sort occurring. Bone is another one that you don't think about a whole lot, but for me personally, I have a donor bone in my neck. It was used to stabilize. I had some C-spine issues and ended up with a fusion, and rather than having my own bone removed from my body, they actually offered a donor bone, and I said, sure, why not? And I've not had any issues at all. So there's lots and lots of different things. Burn victims is another big one. Skin is a tissue. So certainly during times of foreign war, there was a lot higher impact for the need for tissue because of the burn victims that were occurring with our military. So it's just there's so many things.
Yeah.
It truly is such an art and a science that it's endless. You could talk for hours and research for hours about the different opportunities that there are inside that donation and transplant world.
Absolutely. Well, thank you so much about sharing your own personal experience. That's really cool. So question number 4, which organs and tissues can be donated after death?
Well, I think it's important to identify what is actually considered organs and what is actually considered tissue. For those in the medical world, it comes to us a lot easier in the healthcare, especially for those that provide, bedside service or a physician, or those that are medically inclined will certainly understand. But for those that aren't, an organ for the act of donation it includes the heart, kidneys, pancreas, lungs, liver, and small intestines. And tissue includes cornea, skin, bone, heart valves, blood vessels, and tendons. So there's a lot in our bodies that can actually be recycled, is what I like to consider it, for the act of donation. So there's quite a bit, and the research continues. I mean, I've been a nurse for 30 years, and whenever I started 30 years ago, I hadn't even really heard about donation, honestly. And I've been here at Phelps for, I think this was 22 years, I think, this year. And intestines weren't something that was listed when we first joined the Mid-America Transplant Service. That's evolved since, in the last 20 years, that they've added the intestine as part of something that can be donated and something that's needed. So I think that it's something that you have to just kind of, at the time that you're involved in something, you have to go back and look again to see what the procurement companies are identifying as the organ and tissue. But currently this is what they consider a donation.
So I'm going to use the term that you had shared earlier because I thought this was a really great way to phrase organ and tissue donation as recyclables. So have those recyclables, I know they've continued to grow, but do you see that list even continuing to grow further into the future?
I think that science is like so advanced, and they continue to see needs and wants and desires. I think that that as long as there's a need, they will continue to try to research if there's a feasible fix through the act of donation. So I think that as we see, evolving medical issues or healthcare needs with individuals, that we'll continue to see that there might be more research done on certain aspects of our bodies that maybe haven't been considered currently. I would not rule out any type of forwarding research that would organize the possibility of a different portion of our body to be donated.
Absolutely. So moving on to question 5, when are organs recovered during the process of donation?
Organ donation is like very, it's a very tactical approach because everything has to align perfectly. So when we talk about organ donation, we talk about an individual that for one reason or another does not have the ability to continue to live without the support of machines. So typically what we see is somebody with a traumatic brain injury, whether it's from a stroke or whether it's from another act of trauma, such as an injury that occurred or something of that nature, where the brain no longer can function to the capacity that it needs to continue to live in a manner that's sustainable without assistance of machines. So that type of donation has to occur as soon as possible. But that being said, there are many different aspects of the donation that happen on the procurement side, which is the Mid-America Transplant Service in the St. Louis area, that could it could delay that donation up to 24 hours. And in that 24-hour period, they are working very consciously about keeping all of the organs that are going to be harvested, is what they call it, when they're taken from an individual and then transplanted. There are many things that have to be done just to ensure that everything is in line. And some of that would take up to 24 hours. But typically we say that donation is probably going to happen within 12 hours from the time that the patient is determined brain dead. And that's an important aspect of the organ donation as well. Now for tissue donation, which is probably your next question, it can happen up to 24 hours. So there is some time with the tissue donation side.
Yeah, so that's perfect as a segue into our next question, because how does the process of organ donation work at Phelps Health? Is it a 24-hour period? Is it immediate? Who all is involved? Let's talk a little bit about what that process looks like for us.
Well, I'd like to kind of cover that in two separate things.
Mhm.
For tissue, which we're talking about an individual that is no longer breathing or does not have a heartbeat. Tissue is approached a little bit differently than the organ donation side. For the tissue, if we know that death is coming, and sometimes that it's imminent, we know that it's coming, we don't know when, but it's obvious that that's going to occur, we can make a pre-phone call to the Mid-America Transplant System. And it's important, I think, for us to note that sometimes we've been called vultures. Sometimes this act or this approach is not received very well by individuals that are part of the family at the bedside or maybe abroad. But it's mandated by the federal government that every individual that dies has the opportunity and that we approach the act of donation. So this isn't something that Phelps Health decided, oh, we want to be a part of this and this is what we're going to do and we're going to pioneer or we're going to pilot something. This is actually like a regulation that is set forth by the Centers for Medicare and Medicaid. So we have to abide by that. So every individual that passes or dies is approached about donation, but we don't make that approach until we make that call to Mid-America Transplant, because what we do is we share the individual's current healthcare condition, and they make a determination whether or not that individual that's passing or that has passed is even suitable for donation. Because if an individual has an active cancer, for instance, that may make them not eligible for the donation, there's no sense in approaching a subject that may upset somebody if there's not any possibility that that could even be an opportunity for them. So if it's deemed that the individual cannot donate, we don't approach. But in that same phone call to Mid-America Transplant, which we're going to discuss later in this call, but is they tell us if that individual is part of the first person consent. And we'll cover that a little bit later, but basically short for now is that that individual's already made that determination that they want to be a donor and they are able to provide that information. And the approach is just a little bit different if they are on that list. Switching gears to the organ donation side, there again, a lot of times the staff that are working with and for that patient, they know if something is not right and something's coming. And oftentimes for determining brain death, it's not something that you just do in 20 minutes or with one doctor visit or even with one physician. It's something that takes quite a few hours just to line up and to organize the different aspects that we have to confirm medically with the brain death side of things. So with that, we actually, whenever we make contact with Mid-America, we tell them that we think we might have someone who is going to be declared brain dead in the near future. They, again, evaluate the individual. We share information about the chart. And if they see that it's a possibility, they actually assign a whole team of healthcare professionals from the organ donation side of things that then begins to work in a synchronized manner to find out just exactly what can and can't be, and is it even an option? Is there a need for the donation even? And then as we get closer to determining that brain death, they actually send that crew here. So they provide on-site support for not only the staff, but they also send some emotional support staff along that actually become part of the team here at Phelps Health, but more importantly, they become part of the family team. So once that determination's made, it's Mid-America Transplant that actually approaches the family or the next of kin with the rest of the donation information. So it's actually their team members that approach to get that consent if the person's not first person consent. So it's actually a very big team effort. Takes a lot of moving parts and a lot of individuals pour their heart and soul into it for that time period. So it's a huge team that does the approach here at Phelps Health. And ultimately that individual then does lead our facility. We currently do not do any harvesting or removal of organs or transplants inside Phelps Health.
Good to know. Yeah, it's really cool to hear how collaborative that effort is and how much support there is for the family. So moving along to our next question, how are recipients matched to donors? So once it's already been harvested and everything's been taken that can be used, how do people get matched?
There's actually a nationwide database that's kept. So if an individual has, let's use some renal failure, for example, or the kidneys aren't working appropriately and they need to have dialysis 3 to 4 days a week, and the rest of their bodies, met criteria to be on that transplant list. They have different testing that's done, including like blood type, even my height and my weight would be included into that database. And basically any procurement company that provides that service has access to all the individuals that are on that transplant list. And of course, there's many, many detailed guidelines to be on that transplant list. And only certain physicians declare that and facilitate that individuals be put on that transplant list. So first and foremost, I would say that whenever we call them, they have probably already looked at the aerial listing of who needs the transplants, because oftentimes the same time that they're coming here to our facility to pick up the patient, they're calling another person telling them, hey, guess what? We think that we have your heart. We think that we have your lung. And they're headed to the same hospital at the same time. So there's prepping done on both sides. But it's called UNOS, which is UNOS, and it's just a nationwide database. So it's not just the blood type that has to match, body type, weight, size, all of that are essential to the matching portion of that. So I would say it's so complex that it would be really hard to summarize it in even hours with what is going on behind the scenes to ensure that match is appropriate.
Yeah, I think you did a great job kind of giving a really brief overview of a process that, like you said, is really difficult and really lengthy and has lots of moving parts. So this next question is something that I personally have heard, and I know a lot of other people have heard this too. So it's that I've heard that if I'm in an accident or dying, that paramedics or doctors won't try to save my life because I have a heart on my license. Is this true? Let's debunk that myth.
Oh my gosh, that is one that's been around forever. That is absolutely positively false. And I want to follow that up with two statements. First and foremost, anybody who enters either emergency medicine or healthcare in general, not only takes an oath to do good, but we also enter the workforce with the intent to work feverishly to save everyone that we possibly can. Secondly, I want to say that anyone who understands the art of donation or has participated in the medical side of donation would have certainly a testimony to how healthy that donor needs to be. If you're completely, if we have, and I don't mean disrespectful, but if you have a trashed out health, meaning you've got COPD and you've got congestive heart failure and years of being on prednisone has caused your skin to be thin and now your kidneys aren't working, that's not an individual that's probably going to be able to donate. It's the individuals that it's one aspect of their body that maybe is failing that allows them to be that donor. So I would say that what needs to be put out there is that we work so hard to try to save everyone, but when we see that we can't save them or the determination has been made by a higher power that we're not going to be able to save them, that is when we flip to the donation side. We don't give up. We fight until the bitter end to try to save someone. It's only when those medical needs have become greater than what we can provide, or greater than anybody can provide, that we actually switch our gears to seeing if donation is feasible. And we see that as a way to not only allow an individual to make a difference in somebody else's life, but also to save multiple individuals if that's what actually transpires.
Yeah, I think you for sure debunked that myth. So we're going to take a second and do just one more polling question. Let me go ahead and populate that for everybody. Do you know someone who has donated tissues or organs? Again, this is completely anonymous. So feel free to answer just however you feel comfortable. We'll give everybody about 10 more seconds. Just a couple more seconds. And we're going to go ahead and end the polling, and I'll share these results. These results are kind of interesting to me. Cindy, you might even be able to speak to this. There are quite a few people that don't know somebody who has donated tissues or organs. And part of me wonders if it's because it's just not openly talked about very often. I don't know, Cindy, if you can answer that question, if organ donation is something that a lot of people talk about. Maybe there are a lot of people who have had donated tissues or organs and we just don't know.
I think it's something that sometimes many people keep it private because you just don't know what how the individuals feel that are surrounding you. So I find that you're either 100% pro donation, and at the funeral service or at the visitation, you might even see Donate Life armbands, or they might have the medallion. They actually give like a brass medallion to those that donate organs. That's really big, and it's amazing. They give that to honor that hero. So it's sort of like a medal of honor that you would get from war. But it's much bigger, and the family oftentimes displays that if they're pro donation. I think that some people are still fearful about how one might react to the donation. So I think that there's some hesitancy at times, I guess, about speaking about it. But I would also say that the other way of looking at it is that maybe in some areas it's become the norm, like especially for tissue donation, that it's not talked about. But I think that more often than not, it's more of the individual that's afraid that they might hear someone, overhear a conversation about someone who's maybe not for donation, say, I can't believe that they would possibly donate Aunt Ethel's eyes. That's, and how hurtful that would be to hear it. So I think some people just don't keep it, they keep it on the lowdown just to avoid those type of conversations, or those overheard conversations that may be hurtful as well.
Great. Thanks so much for answering that, Cindy. So we're going to move along with our question. So question number 9 is, has COVID-19 changed the donation process, and is there guidance on organ donor testing?
Well, I'd like to start by kind of chuckling. What has the pandemic left alone?
Mhm.
So early on in the heightened months where COVID-19 was such a hot topic and was spreading, and we were seeing so many deaths related to it, it did affect it drastically, honestly, because they weren't allowing teams to come or to leave the facility, but they also weren't allowing people to come. So it's almost as if for at least a brief period, until we could figure out what COVID-19 actually held in store for this area, that it's almost like the donation process was almost placed on hold. Definitely it changed like the aspects of the approaches for a determined period of time, and it continues to kind of affect it somewhat. And I guess an example would be our last attempt at an organ donation here on a patient. They would only allow like one person to come from that healthcare team that we were used to seeing 4 from. So they're not allowing as many to travel together, or to be together, or they're not risking exposure, at least from sending so many to the same populated area. So that's one way that we've seen it change. But the other way that we've seen it change is that obviously they test for COVID-19 on any individual that's considered for donation. And that if they're still active, COVID, obviously they're declined for donation still at this point. So I think that we're still learning so much about the pandemic and the COVID-19 reaction that this will be another topic that I think will evolve for years to come, about what has it done, and not the not known, I guess, factors that may be associated with that virus that we might see years down the road that we're not aware of at this point may also influence it in the future.
Yeah, boy, you make a really great point, which is perfect for our next question. What about people who are no longer testing positive for COVID-19? Can they be organ donors at that point in time, or what does that process look like?
I think that that's still it's so individualized that certainly when the team evaluates an individual, that is one of the things that would be become part of that topic or part of that history review would be, if they were positive and how long ago were they positive, and there's certainly going to be more blood work and testing associated with that. And if they see that there's a risk to anybody on the receiving end, of course, they would never take the donation or even risk the transport of that individual. So it's really something that I think is so individualized that there's not a real solid answer to that.
Mm-hmm. So moving along, let's say somebody can be a donor. Can people be too old or too sick to donate? What does that look like? Because I know you just said it was very individualized. So let's talk a little bit more about that.
Um, when you ask too old or too sick, I would say yes on both of those. But what I'm going to follow that up with, it depends on sickness and it depends on the need. With that being said, one of the examples that I can provide is that a 75-year-old who passes away today maybe had a history of cancer, but not active cancer now, was infection free. Mid-America Transplant may say absolutely they can be a donor for tissue, and we can follow through with the process at that age. However, next week we can make the same call for the same age, and it may be declined, and it could be declined because of a certain lab result that came back or a history of something that is too high of a risk for transplant, of even skin and tissue. But then they also look at how much is stored. So I guess an easy way to put this would be that they don't take something they don't need. Mm-hmm. So if the eye banks have plenty of corneas, they won't just take more and more and more. They look at the need for the area. They look at how much is in storage. They look at past use, so that they're not just taking what they're not going to use. So we do see declinations because of that. We also see tissue declined because people are either too large or too small, which oftentimes is not talked about a whole lot. So someone can be too obese to donate, and somebody can be too thin. So it's definitely two ends of the spectrum, but they're very drastic ends of the spectrum. And that's why it's so important with each individual. We call and we share the information with a team of experts, and together they collaborate and make a decision on whether or not that individual is eligible for donation or not, based on all of those different factors.
Yeah, that's really detailed. I had no idea that somebody could be too obese or even too thin to donate. So great information. So kind of moving along, how can I become an organ, eye, and tissue donor?
Well, I'm going to share that Missouri has MissouriOrganDonor.com, which is like this really amazing website, or DonateLifeMissouri.org is another one. There is all kinds of information on there. There's Mythbusters, there's facts, there's detailed information about the registry, like who's waiting for what in the state of Missouri, with numbers that flash across that are updated sporadically. But there are multiple ways for you as an individual to actually register or to become a donor. The first is Missouri Registry online. The second would be at the Missouri Department of Revenue. If you renew your driver's license, or you get your driver's license for the first time, or you go get like a non-driver ID, all of those are opportunities at the Department of Revenue to make your wishes known about being an organ donor. And those are indicated on the printable license with the small heart and the green ribbon on them, which it's almost ironic because at the time of death, if it's a traumatic death, that's the last thing you're worried about is a license. So it's nice to see, but it's definitely not something that we rely on, but it does put you on the registry. There's also a registration form that you can print and fill out and mail it back in. There's a toll-free number. It's 888-497-4564. They'll mail you a copy of the registration form if you don't have a computer. You can sign the back of your driver's license with a permanent marker and have a witness. Advance directives, you can include that in that advance directive or living will as part of your advance directive. And then that you can also sign and carry a donor card or other signed record. And then last but not least, you can communicate it and two individuals can vouch that that's what you wanted, or your significant other or legal next of kin can also be aware of that decision and they can make that decision for you. But I support the foolproof method of making it known legally in the form of a first person consent, which is either the registry online, mailing it in, or the driver's license bureau. Those are probably the three most consistent and the most foolproof, in my opinion.
Awesome. So I'm going to sidebar for a second. Hillary, my colleague over here in marketing, actually put the link into the chat. So you are welcome to check that out if you have questions. There should be like a Q&A on there probably as well. So that link is available. So next I want to move on to question 13, which is, can I indicate specific organs or tissue that I want to donate?
You can, absolutely. I think that there are individuals that have indicated that in the past that we've experienced here at Phelps Health. There's always the opportunity to designate those type of things. Certainly on the more lengthy forms like your advanced directives or your living wills, where you have the opportunity to include some of those. But even the registry, I believe, asks if there's any limits on what you're willing to donate. So those can definitely be provided, and we do honor those. We are respectful to any wishes.
Perfect. Moving on to question 14, will donation disfigure my body or even, the body of a loved one? Can there be an open casket funeral after somebody has decided to donate?
I think the answer to that is that anytime there's removal of anything, there's a certain amount of disfigurement. With that being said, I think that the art of donation has been perfected over the course of many, many years to the point where it's undetectable to an untrained person at an open casket funeral. And it also depends on what is donated. For instance, skin donation alone, or even the eyes, would never even be known. Typically what we see or what we hear when it's got to do with disfigurement is sometimes the long bone of the bodies, but they put prosthetics in, so it should not make it appear any different. But I've had individuals tell me that they noticed that the dad's arm was just a little bit shorter, and it might be that they knew about donation, they knew that it happened, and it might be that it wasn't, because they're supposed to be measured and prosthetically the same when they do that. But I think that there would be some argue that there it is noted, but I would say that more often than not, you cannot tell at all that any type of donation has been made from that individual.
So moving on to question 15, I think this is something that a lot of people may struggle with. How do I discuss organ and tissue donation with my loved ones?
I think it just has to be an open dialogue. I think you have to start with, maybe how do you feel about donation, and just have an open dialogue with individuals that you are around, that love and support you, that would potentially be present if something were to happen to you. I know that it's a subject that's a little bit tough, but I think when you ask somebody else how they feel, they're probably going to turn around and look at you and say, well, how do you feel? So that provides, an opportunity to either say, I've thought about it, and I really believe that if something's going to happen to me and I can't live, that I'm good with giving to anyone that needs anything. And I think that that opens up, that dialogue and allows you to tell them what you want. In that same topic, though, I think that it's okay and perfectly fine that when you have that dialogue with somebody that whenever they tell you their response is that they don't want to donate, that you also respect that and you make note of that, because you might be their support person that would have to make that decision. Because some of the most difficult times that I've encountered on the nursing side is whenever a death occurs, and I don't care how prepared that you are for that death. It's an emotional time, it's an emotional roller coaster. And if you haven't had the opportunity to have a conversation about like death and dying or donation, or even what that individual wants if end of life happens or occurs, it's extremely difficult to make that decision when you're approached and you're the one that they're asking, well, would they want to be a donor? They're eligible to be a tissue donor. And that individual then has to make that decision. And there's lots of emotion that comes with that as a family member, because you're like, oh gosh, I don't know if they wanted to or not. And if I do, what if they didn't want to be a donor? And if I don't, what if they did want to be a donor? I mean, there's just so many turns and turmoil associated with that, that having that open conversation, and that conversation when people are healthy, makes that a lot easier on the people that you leave behind. And there again, that's if you're against or you're for. The one thing that I always take whenever I have the opportunity to talk about organ and tissue donation is that I tell people, I'm comfortable with whatever decision you make. I'll stand beside you. I'll fight for you, whichever decision that you make. But what I want to do is be able to provide everyone an educated opportunity to make that decision. I don't want to have individuals that are making that decision and not take the opportunity to try to educate them about it. So every opportunity that I have to talk about it, I definitely share everything that I know, everything that I've learned, what I've experienced, not to persuade somebody, but to provide them the knowledge that they need to make an educated decision about whether or not to be a donor or not. So I think that's just as important.
Yeah, I would agree with that as well. So I know that you've already kind of answered question 16, but let's just very quickly go over it again. Let's say somebody decides that they do want to be an organ donor, or even they don't. How do they make their decision known?
Well, I think first and foremost, if you are for it, it's very important to visit something and make it known in writing, such as the donatelifemissouri.org registry that was displayed in the chat. The second thing is, if you don't want to be a donor or you do, I think it's important to share that information, definitely through communication throughout your family and those that would be there. I think that the hardest thing is just, it's a form of communication, whether it's through a website, whether it's through a donor registry, or through a verbal conversation. It's all communication. So I would say the first and foremost important thing about donation is that make your wishes known by communicating it.
Yeah, I think that's great. So moving on to question 17, this is something that my husband's family actually just went through with his grandparents. They set up their own advanced directives. So what is an advanced directive for healthcare choices?
I look at advanced directives as a guideline or guardrails for future health issues. So individuals can define what choices they would like in the event that they cannot make those decisions any longer for themselves. So oftentimes what we see in healthcare is that they have an advanced directive, which also designates a healthcare power of attorney, a durable power of attorney, which then says, if I can't make my own choices, this is who I want to make those choices. But in the same document, it can indicate to the healthcare team, if I get to a point where my heart stops, I don't want CPR. I don't want to be intubated or put on, breathing machines or a ventilator. It can also say, I never want a feeding tube. Don't put a feeding tube in me. It just allows the individuals to define what they're willing to accept and how far they're willing to accept those life-saving measures in the event that you're no longer able to make those informed choices yourself.
So the next question kind of piggybacks off of that as well. Do I have to have an advance directive for healthcare choices in order to be a donor?
No, they can be completely two independent directives. You can be first person consent or have your organ donation determination, and your healthcare advance directive can be separate as well. Um, the one thing that I would point out is that your advance directives are something that individuals have to carry with them or provide. And oftentimes you'll see that if you're admitted, even if you're admitted a month later, you're going to be asked again about your advanced directive, and you're probably going to be asked to bring another copy of them, just because if those change, scanning a copy in 6 months from now, that individual could have changed their mind and it could have been updated. So we always try to ask for the most updated copy for advanced directives, because there's so many pieces to that document. However, on the organ donation side, you can go back online and change your mind and take yourself off of that registry, or you can call and have yourself removed if you can provide certain details so that they know for sure that it's you. You can also go in there and designate or restrict the donation down to which organs that you feel most comfortable with donating. So both of them require updating, but I would say that when you have the advanced directive and knowing that it's on paper and there's not a nationwide system for that, you definitely want to keep your most updated copies with you and your loved ones to provide healthcare with a copy at the time of need.
Perfect. So question number 19, can I be an organ and tissue donor and also donate my body to medical science?
It's been my experience that answer is no. However, if that were to occur again, at least at Phelps Health, what we would do is we would make sure that Mid-America Transplant, which is the organ procurement system that we have, knows about the possible donation to science, and they would have to work together. And a lot of times what we've seen is that whenever you donate your body to medical science, it just depends on what school it's going to, because they typically want everything whole. And so sometimes the donation doesn't necessarily get to occur because of the two don't really meet. They don't match with that need. With that being said, that's not to say that there might be a school that's willing to allow some sort of donation and still take the body. All of that also has to be prearranged by family. It's not something that's easy to do at the time of death. So donation of whole body is something that is very, very difficult at the time of death to find a location and a company that's willing to accept that body. So those prearranged could definitely have a conversation with whichever medical science company that they're allowing to receive their body at time of death. They could make their wishes known, maybe on some form for them, and get those answered questions from that facility and not necessarily at the time of death too. And then the family would know, if I'm donating my body, I can't be a donor, or if I'm donating body, be sure that they know that I can. I think it just depends on the school that's accepting.
Great. Yeah, I think it's really important. You've mentioned this a couple of times, to really kind of think about what you want to happen to your body in the event that, you could be an organ donor, and really what you want to happen. So question number 20, now I want to ask about your experience in your field. How does organ donation help the donor's family deal with their grief?
Um, I think that it may not be like an immediate response, but I truly feel that in the days to come, that the art of donation provides some patch of compassion to those families that have encountered such a loss, and knowing that their loved one has not only provided the ability for someone's life to be enhanced or to be saved, but it's also the legacy that lives on, because it's such a selfless act to donate, especially if that individual's made that decision up front, to love another human that you don't even know so much, to give of yourself at the time of death is just, it's a huge act. It's probably the largest act of human love that I can think of. That legacy, a lot, it just allows for it to live on forever. I don't know too many other acts at a time of death that allow you to enhance or save 50 plus lives. That's just, to me, it's like a huge gift,
Mhm.
and one that I hope that if I am um, unfortunate enough to have a demise, that my body's healthy enough to donate, because I want to be able to give those 58 people anything that I can.
Yeah, I think that's really special. Thank you for sharing that. So question number one, is there support for donor families?
There's many avenues of support for those families, but I think that the support that the procurement companies provide is probably the most common support, because we support them through the time that we have the individual. But here at Phelps Health, we don't necessarily have after donation support available here through our services, and that's mainly because um, they become a family to those procurement companies. So like Mid-America Transplant often provides emotional support, not just for the immediate time period, but for the months and years to come. They also annually provide like a celebration of donation, with big celebrations before the pandemic, where you were invited to be part of that celebration. There's also online support that's available. There's support groups that meet in some more populated areas, not necessarily here in the Phelps County area, but definitely in the larger cities have some support groups as well.
Yeah, that's amazing. It seems like there are lots of opportunities for donor families to have support or to reach out for support. So we're kind of running a little low on time, but we have one more question before we wrap up. Who can I contact if I have more questions about organ and tissue donation?
Um, I'm more than happy to take the time to answer anything that I can. And my email address is cbutler@phelpshealth.org. But I think more importantly, many of those questions can be answered just by visiting, the websites that have been provided. The Missouri has countless opportunities, or endless, I should say, links to different information, even through the Division of Health and Senior Services. That's another site, a state site, which is a .gov site that provides a lot of information. But certainly the link that was posted in the chat is probably one of the healthiest links that I have, and available. And that, quite honestly, I referenced it right before we started this today, because it's just a lot of information that lies there with the myths and the facts. There's also some success stories, and many, many other opportunities exist on that site to educate yourselves or others about the donation.
I love that. Thank you so much, Cindy. It looks like Hillary put another link. This one is actually on our website. It's phelpshealth.org/patients, visitors, /organ tissue donation. So if you do have questions, you can also visit our website as well. So we are going to go ahead and wrap up today. Thank you so much to everyone for tuning into the Scope at Lunch. A huge thank you to Cindy Butler for joining us today. I know this topic is often difficult to talk about, but you did a really awesome job providing insight and sharing that with our community. Thank you so much.
Thank you so much.
Yeah, so as a reminder, this show has been recorded and it will be emailed to all participants. It can also be rewatched on our Facebook page, which we will put up later today. That way you all can share it with family and friends and begin having those types of conversations. If you liked this show and would like to know